great to have you all with us at Cosmetic Surgery Forum in Nash, Vegas. And with us right now is Dr. Chytra Anand from India, who's spoken here extensively. So you talked about masseters and parotid gland and really facial contouring. So start with that.
Yeah, so I spoke about using neuromodulators for facial contouring. And in Asia, we have a lot of faces that are bulky and they have a wider bigonial width. So we spoke about using neuromodulators safely to help reduce the bulk of the masseters, the superficial and the deep head, and to also work with the parotid swelling, which most people forget to take care of, which actually debulks the face beautifully.
So this is something that was described back in Korea many years ago, and they have some CT imaging that really correlates with the clinical picture, documenting efficacy. It's something that really has been sort of picking up traction in the past couple years, and I think we're going to see some indications for this. But it is something that can make a pretty dramatic impact for our patients. What have you found?
4 to 6 weeks, and it's like it's a new person and a new face. And, you know, especially great for people who are like slim and they always feel like they've had a fat face. This is just perfect for them. And the changes are so dramatic, it's almost life-changing.
Excellent. So just change gears. You talked about stem cells. You know, as we see people with androgenetic alopecia that are losing areas of hair, you know, and in specific areas you see the recession. Take us through how you decide between stem cell injections versus PRP injections and those types of things. Keep in mind, from a regulatory standpoint, there's different issues in different countries.
Yeah. Well, in India, where I practice, stem cells and PRP are legal for us to do. So it's not a problem. But this is basically where we take micrografts. There are 3 millimeter punch micrografts in the hair follicular margin. So we're actually taking like the bulge area, which has your epithelial stem cells, and then it gets spliced in a machine which has 600 microblades. So it really takes out all the particulate matter, etc., and gives you a solution. So we get about 4 ml, which we inject into the scalp in a 4 inch by 4 inch area. And the choice, patient choice is critical here. So we only go with the initial grades of androgenetic alopecia, like grade 1 and grade 2. The results are excellent. And we have a criteria for this. So it's key that people have hair miniaturization, so the follicle has to show miniaturization. If it does, that's when we get great results with this particular treatment. And it's just one session, 6 months, even once a year if it's a low-grade AGA. But what's important is it's painless. The reason is there's actually no vascular component, like there's no blood, so the pain of PRP is taken away.
So what else are you doing in India that we might not be hearing about here just yet? I mean, you have a lot of sort of experience and tricks and have a very successful cosmetic practice.
Yeah, so there's so much. Don't get me started. How much time do we have?
You got time.
Well, this is one, but we're also starting now to use the same micrograft and solution in acne scar treatment. And we're using that for acne scars and also for skin rejuvenation to see if we can actually get that skin looking healthier, because we've been doing PRP for almost 7 years now in India. And so we inject PRP, we use it post-microneedling. So now we're working with the stem cells and seeing if this can help us get better results, and also for regeneration for the quality of skin, and especially in the neck, because, you know, nothing really helps the neck. So we're trying to work on skin quality with this right there.
Thanks for joining us at Cosmetic Surgery Forum.